Um, by kind courtesy of Omega Live TV, we had the privilege of telecasting live for the first time a health show here in London. I want to say a big thank you to Archbishop Frimpong Manso for being the host on that day. And I want to say a big thank you to Omega Live TV as well for giving us the platform to present this all-important health show. I have a very special guest in our midst tonight, but before I go on to introduce our guest or give her the opportunity to introduce herself, again, I just want to say that Omega Live TV is one of the branches of Omega House, and they bring us a lot of platforms, including this very one. They are into videos for events, parties. They are into gift items, printing of all sorts of, like passport pictures, banners. So if you want a coverage of your event, you know where to find them. And you can find them on 189 Wood Street here in London, E17 3NU. And again, you can also locate them on 74 West Green Road, N15 5NS. So once again, I want to say welcome to the show. Before I start, I think it is in order to bring you a feedback of our first live show, which I happen to present on cardiac disease, specifically on heart attacks. And I'm very grateful for all the feedback you gave us on the show. And that is the reason why I believe that we need to keep doing these shows. Tonight we are presenting in English. The first episode was in Fanti, I should say, was in Fanti, but I think it's in order. The feedback suggests that a lot of people, even Ghanaians, were struggling to understand the Fanti language and the Twi language. So I will do my best to interpret as much as I can, but we will be presenting the show from now on in English. So I'll give the opportunity to my guest to introduce herself. And tonight we will be looking at an overview into kidney disease. So she is here in London. You are warmly welcome to the show. If you could do me the honor of introducing yourself, I will be very privileged.
Thank you, Winifred, and hello, viewers. I'm very privileged to be in here. It's a very important day for me as well. My name is Winifred Yeboah. Other people know me as Winifred Asari, and I'm a kidney nurse, and I work in a prestigious hospital here in London. I did say today is a very special day for me because 3 years ago today I lost my brother, Emmanuel Ajekum Asari, known as Othello, and he was an old saint. And so I am very, very happy to be here, not just because I'm presenting on kidney disease, but I'm very sure through this and in his memory, we will be able to achieve a lot more when it comes to kidney disease and kidney care.
Oh, well, may his soul rest in perfect peace, and you are warmly welcome to the show as well. So,
thank you.
Kidney disease, we hear a lot about it these days, and it looks like a lot of statistics are suggesting that kidney disease is more frequent now than it's ever been. So can you just tell me about it? What is it?
Okay, sorry, thank you, Winfred. For us to talk about kidney care, it would be good to have a look at the anatomy and physiology of the kidney itself. So I've got a kidney here. This is a kidney, and the kidney lies on either side of your spine, just below your ribs and behind your back, as I pointed. The kidney, as you can see here, is bean-shaped, just like the kidney beans we know, and it measures 10 to 15 centimeters.
So basically, this is just an enlarged form of it, isn't it?
You're right.
Okay.
And it is proportional to your body size. I did say that your kidneys, some people have got just a single kidney and it works just as fine. And I also said bean shape. Some people have a horseshoe kind of shape. We will talk about that later, but for now we are going to focus on the normal. The right side of your kidney lies a little bit lower compared with the left side, just because of the presence of the liver at that side. So now that we have talked about general kidney, let's look at the inside of the kidney.
So basically that's just a cross section of the kidney when you actually cut it into two, is it?
Correct. So inside the kidney, there is the nephron, which is the functional unit of the kidney. Each of your kidneys have 1 million nephrons, and it is able to make urine on its own. Okay. A high rate of blood flow, together with normal blood pressure inside your kidney, is essential for the formation of urine. Also in your kidney are the glomeruli, which is basically the filter. So it filters the kidney of toxic waste as well as excess water and is excreted as urine.
Okay.
Also, about 20% of cardiac output passes through the kidney every minute, and this allows adequate ultrafiltration as well as selective secretion and excretion of waste products as well as urine.
And this is happening every minute?
Every minute.
Okay.
The cardiac output. You can see there are two big vessels, the renal artery, renal vein, and that is where how it supplies the blood to the kidney.
Okay, so basically the nutrients are coming like rich in oxygen
through your blood,
through the heart, and then it goes down through the artery into the kidney.
Correct.
Okay.
Thank you.
And it requires about 20% of the general output of the heart.
Correct.
Okay.
Yeah.
Right. So what happens inside the kidney then? I mean,
okay.
I know
again, if I could add the third aspect, is a system of collecting duct, and that basically delivers urine to the ureter. About 180 liters of blood is filtered by the kidney each day.
Oh, wow.
178 liters of it is reabsorbed into the body for homeostasis or maintenance of balance.
To maintain the body.
Okay. And 2 liters excreted as urine.
So basically, of the total volume of blood going around and the kidney having the job of filtering all that much, we expect that normally we should be passing about 2 liters of urine. Is that correct?
Correct.
Oh, that's wonderful. Okay, so now we know what the kidney is and where it actually is in the body. Can you just tell us a little bit about how it functions? How does the kidney do this?
Okay, so the most important job of the kidney, like I said, is to filter the waste product. What is the waste product I'm referring to? When we breathe in, when we eat, when we drink, when we inject things, there are certain substances that are not good for the body, and therefore the kidney will have to filter these together with the unwanted water to come out. I can relate to 3 functions of the kidney. There is the excretory function, the regulatory function, and the metabolic function.
I think a lot more of us are probably more familiar with the excretory function,
which is what we have been talking about, filtering the blood of all toxic waste and excreting the toxic waste as urine out. Okay.
Right, so if I can recap,
Yeah.
basically everything going into our body needs to be taken care of. The good parts sort of taken by the body retained,
Yeah.
and then the bad parts just left and it comes out as urine.
Yes.
Right. Okay.
So the regulatory function comes out as maintaining fluid and electrolyte balance, maintaining blood pressure, and maintaining a pH neutral blood or acid-base balance, if we go into the scientific way.
Yeah, so these are quite technical, isn't it? So for
Yeah.
the ordinary man on the street, all we really want to know is that the kidney has got a very important job to do
Yes.
in sort of making you feel normal.
Correct.
On a daily basis,
On a
really,
daily
because this
basis.
job is on a daily basis. So what about the metabolic function then?
Great. So with the metabolic function, we are looking at activation of vitamin D. A lot of us talk about going through the sun for vitamin D and that sort of thing. So it is activated actually in the liver through intestinal absorption of calcium. And this helps with bone health.
Wow, so there's so much to know about this one. Yeah, I
Also,
can't even quite remember all the anatomy
Yeah.
we did in school, you know.
Yeah.
Right, so
Also, it produces renin, which helps with blood pressure control, as well as the production of erythropoietin, which helps with red blood cell production and anemia management.
so basically the kidney is not just for filtering our blood and producing urine then.
Exactly.
There's
There are
a lot
several
more to
others.
it than, yeah. So it's very important we know these things because obviously I'm sure eventually when we look at the signs and symptoms of, you know, how to identify or recognize your kidneys are less functional, these will probably come up and
Yeah.
it will make more meaning to us.
Yeah.
Yeah. So what is kidney disease?
Okay, so if we're looking at chronic kidney disease for the purpose of this interview, it is a progression of your kidneys from health to ill health. And this can result in a complete or permanent failure of the functions of the kidney, as we have discussed previously. So in short, I'm just saying that your kidneys are not working properly, and this condition is likely to last for the rest of your life.
Wow. So how quickly can this happen?
Okay, it's like I said, it's a slowly progressive condition. So it can last for months or even several years.
Before you actually have any signs and symptoms at all?
Correct. So
Wow.
what we know is that the condition is quite on the large scale. In the UK alone, Kidney UK tells us that there are about 3 million people with chronic kidney disease, which is quite astonishing.
That's a lot of people.
Yeah. Out of this 3 million, 63,000 have got kidney failure and are
Without
receiving
knowing.
and are receiving
And
treatment.
are receiving treatment.
Yeah.
Right.
Then there are also about 1,000 children with chronic kidney disease. A staggering 40 to 45,000 people died prematurely because of kidney disease, chronic kidney disease.
Oh, this is very interesting because obviously my specialty is into cardiology and the heart doesn't give you the chance. You know, when something is wrong with it, it really wants you to know straight away that there's something wrong.
Yes.
But it seems like the kidney will give you time.
Yeah.
And it happens over a long time, isn't it?
So the body readjusts and readjusts and readjusts. And if you consider us ethnic minorities, such as Africans, Asians, Caribbeans, we are 5 times more likely to suffer chronic kidney disease.
Wow. Ladies and gentlemen, everyone tuning in, obviously we've looked at where the kidney is in the body, and we've looked at the basic function. A lot of us think that it's just to excrete urine, but there's a lot to it than just excreting urine, isn't it?
Yes.
Yeah, and the prevalence is more with the minorities like black ethnic people, Asians as well. So it is very important that we know about this all-important subject, isn't it, about kidney disease. If you're watching us, you can tune in and watch us live on Facebook, and you can also tune in and please share it on WhatsApp and like our page on Facebook. The topic today is kidney disease, and this is brought to you by kind courtesy of Omega Live TV, and we are obviously live online, and you can watch us now. So back to our topic, how does one know that they actually have kidney disease? How does one
That's
know?
a $1 million question. Having said that, problems with kidney disease is often discovered at a routine blood test, maybe urine test, or even a high blood pressure. Recording can suggest something like that. Also, when you have a condition like high blood pressure or diabetes, your doctor may be monitoring you for kidney disease. And when your doctor suspects there's something wrong with your kidney, maybe there's a problem in your blood results or urine sample, your doctor will go ahead to investigate more specific blood tests, X-ray, ultrasound, or even kidney biopsy.
So is that X-ray of the kidney alone or a general one?
It's everything in there, the ureters and everything along the kidneys. They will do that X-ray.
Okay. So it sounds like most of the people who are diagnosed with this with it is just by accidental finding then.
Usually accidental findings occur, but then if somebody has got high blood pressure, it is good practice that when they go through the annual review, they have that sort of check done, when they have medicines changed, when maybe their blood pressure goes up in between, they have that checked, or even with diabetes, say.
Right.
Yeah.
So what sort of blood tests are we talking about? Because I mean, usually they do a whole lot of tests and we have no idea what they are even checking on us. What should we look out for? What tests should they be
Okay,
doing?
some of the suggestive tests will be things around urea, creatinine, that is the main thing, potassium, looking into the electrolytes. So usually the creatinine as well as the glomerular filtration rate would help us determine what is going on. And this is not done in singular kind of examination. It is important that you consider other factors as well.
So basically all we are talking about is it's not something that you can diagnose by looking at yourself, or you need a doctor to check you out. And I think that is the main emphasis of this show, to enlighten people about different conditions, so they seek help appropriately. So are there any classifications of this disease? Is it just one, like, does it just happen and then suddenly your kidneys have failed? Is that what it is?
So like we were saying earlier, your blood test, like the creatinine bit, will be able to determine what level you are with your kidney function. There are 5 stages of the kidney disease. The first stage is normal kidney function, but there is a damage to the kidney. Your kidney function will be 90% or more. Stage 2 is kidney damage with minimal function, loss of function. And your kidney function would be between 60 to 89%. Stage 3 of the kidney disease is moderate loss of function. And your kidney function is between 30 to 59%. Your doctor will be monitoring you at this point.
So what sort of tests? So is it just through the
Similar
blood
thing.
tests?
Blood
Okay.
tests quite often, so we do renal profile. Renal profile incorporates something like the creatinine I said, the bicarbonate, the potassium, and different labs do different things, so different hospitals do different things. So
And all these are able to help them to diagnose the different stages of the
Yes.
disease.
Yes.
All right. So it means and how many stages do we have then?
I did say 5 stages, so we
Okay.
have got to the stage 4, which is the severe kidney function loss. And at this time, your kidney function will be between 15 to 29%.
Wow.
Your care will be transferred to the specialist kidney center, and at this time you may be experiencing some symptoms of kidney failure, and they will start talking to you about treatment of kidney failure.
Yeah.
Then
so in the
sorry.
initial stages, when it's I can see the percentages are better, like in stage 1, and then by the time it gets to stage 5, then we've really dropped, and it means the kidney is so much worse at that stage. Is that what
Yes.
it means?
Yes.
Yeah. So is it something that can be managed by your GP, or is it so specialized to the extent that you can't be managed by your general practitioner?
As I said earlier, up to stage 3, most patients or most individuals are managed by their GPs.
Okay.
But from 4 into 5, you are referred to the specialist kidney center to be supported. Yeah.
Oh, that's a lot of things then. Anyway, ladies and gentlemen, like I said earlier, we are bringing you this live on YouTube and Facebook. So just like our page, share our page, and invite your friends, invite your family to listen into this chat we are having. Tonight I've got Madam Winifred with us, and she is a specialist nurse here in London, and she's trying to throw more light on kidney disease. Before we go on as well, it's Omega Live TV telecasting, and Omega Live are our main sponsors, and they are into covering events. If you need all your souvenirs for your parties, your gift items, especially around this time of the year, obviously you can contact them, and then they can be reached at 74 West Green Road, N15 5NS here in London, and also at 189 Wood Street, E17 3NU. My guest Winifred will carry on. Looks like the kidney is more complicated than I thought. Yeah, I think the heart is a little bit easier than the kidney. But anyway, now that we know how the kidney works and how it functions, can you tell us now about what are the things to look out for? Because obviously that is our main focus actually, because if we cannot pick it up quickly, and we move from like stage 1 to stage 5, where like there's more damage, then we are in trouble then. So what are the things to look out for? Because I think that's the most important thing to us and to the layman on the street.
Mm-hmm. You're very right. Since this is a slow progressive condition, during the initial stages it is difficult and it's not very evident when it comes to signs and symptoms. However, manifestation of symptoms and or the severity of it may be linked to the cause of your kidney damage or the complications of your existing health problems. So you may see people come in with problems like shortness of breath, swelling of the ankles, feeling tired or lethargic, not able to sleep well, so changes in sleep pattern. There may be nausea, there may be vomiting, decreased appetite, dry skin, itching, maybe feeling cold, leg cramps.
So basically all these are quite, a lot of diseases present like this as well.
Similarly, yes. So that is where I said in the blood results, you just don't look at them in isolation. You combine with other things. And another thing that is prevalent among kidney patients is anxiety or depression, because it's a chronic illness. It drags on in your life. You just can't get out of a particular situation. Yeah. And so they have that, and sometimes it affects their interest in sex, so there is decreased libido. Also, we talked about vitamin D and calcium. They have brittle bone disease.
Oh, that's a lot. That's a lot, actually.
Yeah.
And can it just present, one person have almost all these signs and symptoms at the same time?
Not precisely. You may have some of the symptoms or most of them, and some people can go without it for a very long time. However, when they start treatment, whether it is the tablet form pre-dialysis or not, they might improve on their symptoms.
Oh, so I mean, I don't know whether you had the chance to listen into the program last week where we were treating heart attacks, and I was always saying and hammering on the fact that we really need to listen to our body, because I mean, these could be malaria, it could be a common cold, it could be any other, you know, illness. So but the only way to obviously like diagnose this is through like seeking expert help, isn't it?
That's
right.
Yeah.
Okay. So I mean, like dry skin, who would have thought that you would even be dealing with that? Why is that though?
Dry skin is a number of factors. It may be due to the fact that the toxins collect on the tops of the skin, or the poisons collect on the tops of the skin, and that can make it dry or itchy. Also, there's something called phosphate. So if your phosphate level is quite high, it can contribute to that. Also, we spoke about anemia. If your iron is very low, that can also contribute to that. So several things contribute to this.
So by toxins, these would have been what would have normally been excreted by the body,
yes,
in the form of urine. And for some reason, so basically with the function of the kidney deteriorating over time, then it loses the ability to do that.
Yes.
So the toxins are retained in the body instead of coming out.
Sure.
And leading to dry skin, and I guess that's what's leading to the itchiness and all that as well.
It contributes to several things.
To several things.
You have to remember, certain conditions will contribute to the loss of the kidney function, and all the complications from that pre-existing health issues would impact on you.
Yeah. I mean, you mentioned earlier that like people, I mean, in reading and researching to have this interview, it looks like the prevalence is even more with people with, say, diabetes and hypertension, isn't it?
Yes, you're right here. If you look at the causes of kidney disease or kidney failure, like I said, your pre-existing health issues can contribute to the damage of your kidney. Also, the normal aging process can contribute to the loss of your kidney function, because with age, your kidneys continue to scar and it is unable to repair itself.
Okay.
And like you said, high blood pressure, diabetes, they are the most common cause of kidney disease. And diabetes alone is the most prevalent.
Wow.
Also, we can look into things like infections of the kidney. And I'm going to use big words. Glomerular nephritis,
Oh dear.
or pyelonephritis.
Right.
So the kidney itself has got some sort of infection.
Yeah.
And that can damage the function of the kidney with time.
Right. So basically there's just an infection somewhere, but
Yes.
specifically in the
In
kidney.
the kidney. Yeah.
Precipitating everything else.
Sure.
Right.
Yeah. Also, when you look at an obstruction to urine outflow, there is a backup into the kidney. And so that can contribute to damage of the kidney. Something like obstructive uropathy is often seen in men greater than 60 years, just due to the presence of an enlarged prostate gland. But this is rare in women. However, if it occurs in a woman, maybe the woman would be having some gynecological problems.
So basically, I mean, we just have the kidney here, isn't it? And just to point it out, there are two of them as well, isn't it? One on either side.
That is the normal.
That is the normal.
Because
but then
some
one
people may
can
have just the one and function just as well as you happen to.
Yeah. So the kidneys are there, and then they are tubes leading out of the kidneys,
Yes.
and then it goes into the bladder.
Yes.
So any obstruction in the channel
Yes.
can lead to
The obstructive neuropathy, because it will cause a backflow.
a backflow.
Yeah.
Yeah. So normally there shouldn't be any collection in the kidney, I
No,
guess. So
no.
that's where the problem is. How can we slow this down then?
Okay. Before I get to the slowing down, I want to mention two other things. There is also an obstruction, a delay or limited blood supply to the kidney. That can lead to renovascular disease. And this is found in people who smoke a lot, or where you have cholesterol or fat, too much of it in your body.
Oh, so it's down to cholesterol again. Yeah, I mean, that is pretty much similar to what happens in heart disease.
And that is why I felt I had to mention that. Also, there are some familial diseases like polycystic kidney disease. In this situation, the kidney is infiltrated, or it is overwhelmed with lumps called cysts, and that eats away the kidney with time.
Right. You probably notice, viewers, that a lot of big terms are coming up now to do with the kidney. There are things that would normally no one will be able to diagnose but the specialist, isn't it? So it is very key that when you are having any of these signs and symptoms that have been mentioned earlier, you seek help. Because I guess there will be a whole load of investigations to go on before we arrive at all these polycystic.
Especially as you age, it is important that you take good care of yourself. I mean, like I said earlier, it is similar to the kidney disease. The main thing is that there is cholesterol building up. There is plaques forming in all the blood vessels. So it doesn't just stay in the heart. It lines every single vessel that there is to line and reduces the lumen, the space in which the blood has to flow through. And like we said earlier, the kidney alone needs about 20% of the cardiac output, which is a lot. So if it's not getting that, then there is going to be a lot of problems with the kidney itself performing. So like I said, how do we slow it down? Is there anything we can do to slow this down? That is the most important thing here, isn't it?
Yeah, absolutely.
So many a time we do hear lifestyle changes. It's often easier said than done. Things about healthy eating. It doesn't come easy.
No.
It needs a lot of determination. Exercising, brisk walk. Things that you can do by just walking instead of driving. You can look into that. You can join with friends or other people, especially when we are getting into the end of year, into New Year, some resolutions, we can incorporate that. Also, when you have high blood pressure or diabetes, it is important you have regular review of this issue, and also take your prescribed medications as prescribed. This will help maintain right limits for your diabetes control as well as your blood pressure control. Do attend all other hospital appointments that you have and listen or adhere to the health management advice that is given you. It is important that you avoid certain medications. I'm referring to non-steroidal anti-inflammatory drugs such as Nurofen or ibuprofen. These can further damage your kidneys.
And just to mention, these are over-the-counter medications that we buy for aches and pains, isn't it? So that is where the danger is.
It comes quite handy. Besides the over-the-counter medications, we also buy some medicines over the internet. We also have recreational drugs. We also take drugs from family members because it did help them. Also some herbal drugs. All these things, all these medications may not be thoroughly monitored or regulated. And so it is important that if you are taking any of these things, when you saw your doctor or your nurse or your pharmacist, have your medicines reviewed for you. Again, it is important that if you had any health issue, to involve people that are important to you in the management of your condition, because you will experience maximum care and support based on their understanding of what you are going through. Another thing is that if you have a chronic illness, it tends to impact on your psychology, your mental health. If you are finding it difficult at any point in any way do seek counseling or psychological support so that you can be offered some coping strategies to help manage your condition.
Okay.
Yeah.
And but where can people get this sort of help?
Okay, there are several support services through the GP. And also, if you are formally diagnosed with kidney disease, you can have such support services from your specialist kidney team. But I can say with my hand on my heart, that the GPs do have a lot of services local to you, and you'll be able to tap into it. Or just go onto the internet, find out support services available to you in your area, and then you can check with your GP services whether these are validated services that you can use.
I mean, I'm very interested in the drug side of, people getting medications anyhow, and even to the extent of trying medications belonging to other family members. But it does happen, doesn't it?
It does happen.
And it's one of the dangerous things to ever do, because obviously we don't know the effect. They have been monitored and prescribed those medications, but the other person taking it hasn't had any such review, or it hasn't been prescribed for them. That is one area that I find very, very dangerous, and it's very important that our viewers know that you can't just be buying things off the counter and taking, especially back home in Ghana. You know how easy it is to access some medications. Over here is a bit different. In the UK, there are certain medications that you will simply not get over the counter. But again, considering that, like the medications you mentioned, like ibuprofen and that's just Brufen, Nurofen, which we take quite regularly for any aches and pains, are leading to kidney disease. It's quite scary. So it's really worth noting. So we just stop doing these kind of things. What about the foods that we eat? Does it have an impact at all?
Okay, if you have kidney disease, you have been diagnosed with kidney disease, then you would have support from a kidney dietitian.
Okay. So
they would have a look at your blood results. If you remember what we talked about, the functions of the kidney, there are things to do with fluid and electrolytes. So electrolytes, these are the minerals, the salts. And there are things to do with the vitamin D and your erythropoietin and all those things. So the dietitian will have a look at your blood results and find out where there are problems, things to do with potassium, things to do with calcium, phosphate. Then they will advise what sort of food that are lower in them, or if you need to up it, higher in that.
Okay. I see. So basically, just generally eating healthily is good. Under normal circumstances, we should be able to survive and keep our kidneys healthy just by eating right.
Keeping our portions low, not in large
massive quantities.
Yes,
like we usually do. Okay.
Yes.
Yeah. And what about the treatment options?
Okay, it is good to know that there is help at the end of the tunnel. However, there is no cure for kidney disease. None whatsoever.
None whatsoever?
No. However, treatment like dialysis, transplantation, is able to take over the role of the kidney's function and enable you to live as reasonably well as possible.
So before we get to those, is there any drug treatment at all for kidney disease?
Okay, so like when we were talking, we talked about stage 3, stage 4. So at this time, you'll be getting some drugs, because when we do the blood test, like I said, you will see the dietitian. We also look at your blood results, and anything that we can give you, medicines to enable you maintain the fluid and electrolyte balance, we will give you. Anything to help with your anemia management, we would offer. Anything that will help control your potassium. Potassium is one thing that we get when we eat. And the highest food with the highest potassium level is banana. So it is one particular thing that also controls the muscles of the heart. So when your potassium is too high, it can cause your heart to stop. If it is too low, same. So it is one area that we look at so much and manage our patients from that point of view.
So are we saying too much banana is not good for you?
I'm not saying that. Banana is good for your heart. Again, you can go into it that way, but I'm talking about chronic kidney disease and relating it to your blood results. It all depends on what we are seeing in your blood results.
So
that is why it makes kidney disease, yes, that is why it makes kidney disease very specialized, because whatever you're eating, you have to bring it out. And you don't have to overload your kidney when you have got kidney disease. So you have that sort of direction from your dietitian.
And where does water come in here?
Because you are retaining more than your body needs.
So under normal circumstance, it takes what it needs, and then the rest of it is passed out as urine.
Sure.
So once there's damage, then
it is
may
not able
to cope with how much water. So are they restricted as to how much water they can drink?
It depends on your symptoms. If you are building up a lot of fluid, you are having your ankle swelling, you are having shortness of breath, and we have excluded anything like heart failure and bits that can impact on it as well, then we can restrict your fluid depending on how much you are passing out.
Wow, so there is a lot that goes on then, isn't it, with kidney disease than we probably can think of.
Yes.
I had the singular pleasure of talking to somebody actually when I posted about this interview, and a lady came out to give me a very vivid description of her husband going through the whole all the stages of kidney disease, and I was just really shocked at the kind of the processes, everything that they had to go through. And she was really there, very supportive to the husband, who unfortunately passed away a couple of years ago. But it's just the number of things he just couldn't eat or drink anymore. Was unbelievable and quite sad to hear. Actually,
many a case, our patients are managed holistically. When I say holistically, the cause of your kidney disease is very important, because if you have diabetes and you have kidney failure, you're combining two diet regimes, which can be quite tricky. Yes. So what she experienced might not be the same as another person, what the other person is going to experience. The age at which they had that condition might not be, maybe they were younger, it may be a little bit better than when they are older. So it differs from person to person.
It does differ. But it can happen quite young as well, isn't it?
Yes,
because I remember she told me the husband had it when he was only in his 40s.
Okay.
Yeah.
But you remember I also said about 1,000 children have got chronic kidney disease
as well.
Yeah.
So basically it's something, if the body is telling you something is wrong, you really need to be checked out. That's the bottom line of the whole thing, isn't it?
Many a time people say that, oh, I'm exercising, so I'm okay, and wouldn't really look at all the other bits. And that is where we get ourselves into trouble. So if I could return to where we were with the treatment, going on to what I mentioned, the dialysis and transplantation. When I talk about dialysis, I'm referring to hemodialysis, which is blood dialysis, or peritoneal dialysis, which is tummy dialysis. We can go into depths of this another time, because it is another area on its own. Okay. So about 30,000 people are receiving kidney treatment here in the UK.
Wow. Are these the only treatment options, hemodialysis and peritoneal dialysis?
There is a transplant as well. So with a kidney transplant, this is a surgical operation whereby a kidney is harvested or taken out from a deceased donor. This is somebody who is supported by artificial breathing, or a living donor, so maybe I know you, you know me, and you know I have got kidney disease, and you have gone through the test and you are compatible, you are able to donate to me. Or an altruistic donor, that is where somebody from nowhere comes in, says, you know, I'm touched to do this sort of donation as a gift to somebody who is suffering. So a kidney is taken out of either a deceased donor, a living donor, or an altruistic donor, and is placed into another person. This is the recipient, and it helps recover the function of the kidneys again. Not the pre-existing, but the new one starts functioning as your loss.
Will the diseased kidney be taken out then?
Yes, when I say disease, it's not somebody whose blood flow has stopped and everything. No, that is why I say they may be supported by artificial breathing. So there is some sort of life in them. Yeah.
Okay.
Yeah.
I see. Oh gosh, that's a lot. That's really full on actually.
Yeah. And about 3,000 operations for kidney transplant takes place a year here in the UK.
In the
and
UK
having
alone.
said that, in the same year, you have about 5,000 people still waiting to have a transplant.
Do all these treatments have to happen in hospital?
Operation has to happen in hospital. With the dialysis, some happen in hospitals, some happen in community centers, some happen at home. Peritoneal dialysis in particular happens at home.
At home. Okay.
Also, there is a third option that I didn't mention about the treatment, the supportive care. So supportive care is not about transplant, it's not about dialysis. It is about managing the symptoms of your kidney failure conservatively with medicines. It is often for people with life-limiting conditions like a progressive cancer and people with very complex health issues or functional issues like people with dementia, because it is difficult for them to actually understand what is going on, let alone adhere to or cooperate with the treatment. Yeah.
And that's where the supportive care comes in.
That is where the supportive care comes in.
Oh, that's actually very full on. Okay, so I think tonight we have the opportunity to phone into the program, and just as we are about to round up, I mean, if there is anyone who wants to phone in, you can get through to us on 074 110 96380. 074 110 96380. We are going to leave the phone lines open, and if you want to phone in to ask our guests any questions, you are very welcome to do so. So I'll be waiting. Yeah, so in the meantime, whilst we wait for you to respond, this is coming your way by kind courtesy of Omega Live TV, based here in London. And if you want to get in touch with us, you can get through to us at Omega House 189 Wood Street, E17 3NU. And you can also get through to us on Omega House 74 West Green Road, N15 5NS. Omega House specializes in events coverage, banners, printing, gift items, and you name it, they can do it all for you. So we will wait to see if you want to phone in, and then my guest is going to answer your questions. So in the meantime, whilst we wait to see if people want to phone in or not, if you can just give us just an overview of what we've been going through so far, all the way to the treatment, if you don't mind.
Thank you very much. So we know normally we have two kidneys, and it is at the it's just below the ribs at the back of our body, and we know that our kidney has got the filter in it. It's able to make urine and clear all the poisons or toxins from our body. We also know that the kidney does not only clear the toxins out, it helps with electrolyte balance, it helps with maintaining a neutral pH of your blood. It also helps with blood pressure control. Again, it helps with bone health. So vitamin D, calcium absorption, it helps with anemia correction. So keeping your blood count in a good range.
Yeah.
Again, we have also discovered that there are several causes of kidney failure, and even just the aging process can contribute to your kidneys getting damaged. Again, your pre-existing health issues can also contribute to kidney damage.
So if
However,
you have like diabetes, hypertension,
yes, those are the two main causes. And so if you have got that diagnosis today, please, please, please don't take it for granted. Keep an eye on it, attend your appointments, take your tablets. Be careful with all the other tablets that are not prescribed. I say prescribed because when it is prescribed, it is monitored. When it is prescribed, we are able to tell that it wouldn't interact with any other medicines that you are taking, because we have to factor all those in there.
Yeah.
If you are taking other drugs, I'm not going to say no completely. Make sure when you see your doctor, your nurse, your pharmacist, tell them, let them have a look, let them give you an idea whether this is helpful or not. Yeah, we have also talked about signs and symptoms, but this was a little bit, almost every condition will present that way.
Really.
But I would say that if you feel unwell in any way, we have got our GPs, we have got doctors that are accessible to us. Let's take time off working 24/7 and take care of us, ourselves too. Again, we talked about treatment options, and we looked into kidney transplant, we looked into dialysis, and also supportive care. If at any point you have any idea about somebody who went on any of these treatments, or you really don't understand why we have supportive care, you can still come up over the phone, let us know, and we can talk a little bit more about it.
Yeah, so viewers, our lines are open, and you are very welcome to phone in and ask Madam Winnie any questions that you have on the subject kidney disease. It's just an overview of kidney disease. I think another time we may probably have to invite somebody with the disease, isn't it? Somebody who has actually gone through all the processes of, like all the different stages, to give a first-hand account of the disease. I think that will probably be very helpful, because a lot of this sometimes doesn't even make sense, but sometimes when you hear an account of somebody who has gone through all the stages, it's more meaningful and makes more sense to us. The number to call if you want to phone in is 074-110-96380, and we are still live on Omega Live TV. So the supportive care, what exactly will you be doing for?
Okay, so with the supportive care, like I said, it's for people with limited life expectancy. And so we know these people have almost approached the end of their lives. We offer medicines for the symptoms that they may be having. So whether it's itching or shortness of breath or things to do with swelling, we give medicines to help control the symptoms. It is a situation whereby we try to focus on maintaining someone's comfort and dignity and not really dragging them into hospital invasive investigations and interventions for these people, because already by this time they may be very frail and may not be suitable for a lot of interventions.
Right.
Yeah.
So is that the same as like palliative care?
Certainly. If we look at what we have discussed now, I said there is no cure. And so whatever we are doing, actually, we can say is palliative, because we are relieving patients of their symptoms, but we are not curing them. And palliative is not curative, it's relieving of symptoms, promoting someone's dignity, making them comfortable. So in other words, it's similar, even though one is a little bit invasive than the other.
Right. Okay. You know, I hear about people having all sorts of like lines and procedures like done on their arm for dialysis. What is that?
So now we are going much more into the treatment. What the process in getting someone ready for the treatment, which we haven't covered in this interview.
Okay.
But since you have asked, yes. When somebody chooses hemodialysis, we will create something called a fistula. So we join an artery and a vein together on the arm. It can be on the forearm, it can be on the upper arm. And we have other sites as well when things get complex.
So that is just basically for
Hemodialysis.
Okay.
Also, if we are not able to get this fistula done in good time or maturing in good time to be used for the dialysis, we put in a line. So this line is like a catheter, if I should say it that way, that goes centrally and sit on top
like
of one's heart.
A tube, is it?
A tube, yes, that sits on top of one's heart. And it does the same job as what we will do with the fistula. So that is to get blood out of you. So the blood comes out of you into the machine, it's cleaned out of all the toxins, all the unwanted water, and it's returned to you. Usually, if it is a line, it has 2 lumens. If you have a fistula, we will put 2 big needles. And let me emphasize this, it's big needles, it's not the needle that you use to sew. It's quite good needle to get sufficient blood out of you. If it is peritoneal dialysis, then the tube will go into the peritoneum. So it is just, it is in between the tummy and the the tummy and the internal. There's a small space in there,
like
which
a
we
little
call
pocket.
a little pocket, which we call the peritoneum. So we sit the tube in there, and that is what we use to exchange the toxins and unwanted fluid with.
So does it sort of flush the body out, like get rid of all the impurities, toxins out that way?
Out that way, because it's the small vessels would absorb whatever is put in there, which has got the properties to remove the poisons as well as the fluid.
Oh, wow. Okay, and so that's hemodialysis and peritoneal dialysis. But that is at the end stages, isn't it?
Yes, all the treatment that we have mentioned here, the hemodialysis, peritoneal dialysis, transplantation, is when you have reached kidney stage 5.
Right.
Kidney stage 1, we wouldn't do much. Kidney stage 2, we wouldn't do much. Kidney stage
Can those
3
things be controlled by just diet and
lifestyle changes,
only?
yes, keeping an eye. But like I said, it is a slow progressive condition. So it will still progress slowly. And it all depends on your pre-existing health issues too, and your own lifestyle. Stress on its own can be a big issue and can contribute to you having problems coping with maybe your blood pressure care or your diabetes care, and that escalates. Yeah.
Wow. Well, I think we've almost come to. I think we really need to find another a patient to give an account of their experience through the disease, for it to make more meaning.
I think that would be helpful to viewers in particular, having somebody who has experienced the condition, because we are administering the treatment, but the person receiving it has also got a view, and you'll be surprised at the sort of experiences they have with regards to the various treatments they receive. So yes, that is a good idea to have somebody here.
Yeah, definitely.
There are some resources that people can look into for more information about kidney disease. So Kidney Care UK, you just Google in Kidney Care UK and you have a lot of information. National Kidney Foundation is also another site that people can have a look and get some more information about kidney
that is
disease.
just for viewers in the UK, or it doesn't really?
Internet is available to you.
Everyone.
You can access it wherever you are.
Okay.
Yeah.
Yeah. So my million-dollar question for everyone who will come on here, with all this knowledge, are you going back home to Ghana to help in any way, shape or form?
Certainly. At the moment, I am with an association called Western Region Association of Nurses. Personally, I was trained in Ghana, Efiankwanta Hospital in CKD. And since I have migrated in here, I have experienced a lot of things that even during my training was unavailable. And therefore, it is the association's aim and objective to return to Efiankwanta Hospital in particular, and also support the health services of Western Region by offering our skills as well as our knowledge that we have obtained from working here, supporting students as well as the entire hospital and the region as a whole when it comes to health services and promotion of healthcare. So certainly I am passionately involved with making a change in Ghana.
So we are going home then? Definitely.
we are visiting home.
Visiting only?
Yes.
Right. Anyway, yeah, I'm coming with you anyway.
Thank you.
Yeah, and we are going to Efiankwanta Hospital.
Pleasure.
Does Efiankwanta actually have a dialysis place, or do we even know about it? Kidney?
I can't tell you much about the dialysis. I can tell you if it is up and running. If there are machines or infrastructure in place and they are not functioning, I can't tell you that. But at the moment, to the best of my knowledge, if it is not functioning, it's not there.
Yeah. Well, I mean, the main thing is you are happy to go home and help when the, opportunity
Certainly.
comes, and that does me, like
Certainly.
that is the main thing I am interested in.
Certainly.
Because absolutely, what is the point if we can't go back home and help out in any way, shape or form? So we thank God for this. We thank God for all the knowledge that we have acquired, and hopefully one day when the opportunity comes, we will go back home and help. I remember we met on a diaspora steering committee or something like that, isn't it? Which was focusing on trying to go back home and help, isn't it? And that will be awesome if we will be given the opportunity to go back home and help. So in the absence of any phone calls coming in, obviously this is a very new program that we have started, so it hasn't, not many people know about it, but with time I'm sure people will get to know more about it. So I can only say thank you so much for coming. Ladies and gentlemen and viewers, we've been talking about having an overview into kidney disease, and I have learned so much, even as a health professional, but I am amazed at how much little information, if that, because everyone is so specialized, isn't it? And so it's been a very good eye-opener to me. I've learned a lot, and I hope the viewers have also learned a lot. I have no idea how we were going to say this in Fancy or Chi or Fancy if we actually did this in our local language. And it is very important that we just get so many people involved, so we don't really want language barriers. I hope our families, friends watching can translate, to explain to other people who can't get the language English, so they also have a hang on. So basically, if you are feeling unwell, the body is very good at letting you know that there is something wrong somewhere, and you cannot keep ignoring the symptoms, because it's just basic things like common colds, feeling unwell, feeling under the weather, so many different types of saying you are not well. Please seek urgent help. You can't ignore the symptoms that your body, the warning signs that it gives you. So it's been a very fruitful session, and I cannot wait to have somebody to come and give an account. So whilst we are just trying to round off, if you are a health professional and you want to come on this show, please contact our producers. You can even contact us on this phone number 074110 just so we feature you on the show. It is so important that people get to know where they can seek help, because a lot of the time we seek help but it's a little bit too late, and then all these interventions that could have been done to help us is gone. Please do well to seek help. That is what the health hospitals are there for. That is what the health professionals are there for. Don't leave it till it's too late and nothing can be done. On that note, I want to thank our sponsors, Omega Life TV, for giving us this awesome platform to come and discuss our professions, for giving us the platform for us to share our little knowledge to the public. We can't wait to go to Ghana either, and we'll be bringing you more and more programs, very interesting programs like this. And for my next guest, we will be looking at safeguarding issues. That is a big thing here in the UK, and it's one area that I don't know too much about either. So I cannot wait to bring them here. But I must say that I really appreciate you for coming. You are my first guest, actually. Yeah, so yeah, I am so grateful. And yeah, it's been a big eye-opener. We are rounding off now. Please do look after yourself. Whatever you eat and drink this Christmas, just do everything in moderation, whether it's alcohol, whether it's water. Please look after yourself. Thank you so much, producers of this show, Omega Life, Uncle Joe, Mami Ekua Danswa, Archbishop Frimpong Manso. Thanks for giving me this opportunity to share with my colleagues in the profession. God bless you. Look after yourself, and Happy New Year. Thank you.